Hello, I'm Dr. Ferguson, dermatology consultant at St George's Hospital. In this video, I'm going to give you some advice to help you manage and treat your child's eczema. We can't cure a child's tendency to dry, sensitive skin and eczema, but we have a number of treatments which will help to control their symptoms, treat flare-ups and maintain longer periods between flares. Emollients are moisturisers and they are vital in managing eczema. There are many different ones and we can help you to find one that best suits your child's skin. Emollients come in the form of ointments, creams, lotions or gels. Usually we'll recommend an ointment, as this is greasy and works best at preventing skin dryness. When the weather is warmer, some people find that lighter creams work best. The moisturiser that suits your child's skin is the one that we would recommend using. Use these all over at least twice a day, or more frequently if the eczema is severe. With a tub, please use a spatula or a clean spoon to take the ointment out, because using your hand might introduce infection. Emollients should be applied in the direction of the hair growth, downwards. Even when your child's skin is calm, it will still be dry and prone to further flares. So keep using the moisturisers all over. Soaps and bubble baths are very drying. We recommend a quick, tepid bath daily or every other day using a soap substitute or bath additive. When we say topical, we mean a treatment you apply directly onto your skin. Topical steroids are creams containing corticosteroids, which are hormones normally produced in the body, and they come in a range of strengths. Many parents worry about the side effects of topical steroids, particularly skin thinning. Although this is a potential risk of overuse, we almost never encounter this if creams are used as prescribed. In fact, one of the main causes of eczema flares is underusing steroid creams, which makes your child's eczema more difficult to get under control. Stronger steroid creams are usually reserved for the body, and weaker ones are for the face. Your clinic letter or treatment plan will remind you which topical steroids to use where and how often. Topical steroids will often be prescribed daily to affected areas during flares, reducing down to alternate days, and can sometimes be used as a maintenance treatment at weekends for a few weeks or months. Tapering courses help to prevent the eczema from flaring when the treatment stops. You may hear us use the term fingertip unit, which is this amount, and it should be used to cover an area of skin on your child, which is equivalent to 2 adult hands placed together. Steroids shouldn't be applied at the same time as emollients. It doesn't matter which order you apply them in, just allow 10 minutes for each to soak in. It's very helpful if you bring all your creams with you to clinic, so we know exactly what's being used and how much. The amount of steroid that is safe for your child depends on the area of skin being treated and your child's size. Rarely, in children with very severe eczema, emollients and topical steroids may not control their symptoms, but there are other options. We might arrange for you to see a specialist dermatology nurse to go over your treatment plan. Wraps or bandages soaked in ointment might be used to break the itch-scratch cycle. We may suggest phototherapy treatment, which can be helpful in older children, and occasionally, tablets or injections are needed. We hope you found this information helpful. In another video, I'll tell you about some of the triggers of eczema and give you some practical advice.